before I talk about specifically how the money from the 12-13 year got spent, because I think many people heard about the initiative, but it's like, how did that really translate into real projects? I just want to say that the whole premise of investing Medicaid funding into supportive housing is based on some very substantial research about how supportive housing really does save costs, medical costs, as well as stabilize the lives of our clients. And I just want to say, for those of you who missed my friend Arturo Bendixon's presentation, Arturo took part in a study, a very important study out of Chicago through the Center for Housing and Health that really proved that there was the reduction of costs. And that really is one of the seminal studies and an important one for you to look at when you're if you're trying to understand, so why would the savings come out of here? I think the research has been very convincing. So I wanted to talk about, first I just want to sort of give you an overview of the projects that were funded. And then I'm going to talk a little bit about the side effect of all this, the side benefit, which is the enhanced collaboration that came as a result of the Affordable Housing Work Group, both between providers and between state agencies and among all the different groups that were comprised the Affordable Housing Work Group. So the AIDS Institute received, all of these people funded by the AIDS Institute, you can see received funding. And in New York City, the money went for services. In upstate New York, it went for rental assistance plus services. As Liz said, the Division of Homes and Community Renewal, HCR, used its capital funding for 7 projects. Kohler Goldwater was a project that moved people from nursing homes into the community to a lesser level of care. The other projects were a collaboration, my understanding is, between the Office of Mental Health had rental subsidies and service dollars, and this was capital money that was matched to that. I should also say that there was other money, including money from my agency, from OTDA, from not our MRT funding, but our regular homeless and housing assistance program, that were put into these projects. So you can see that's a substantial number of units that HCR was able to do, supportive housing, with this money. Office of Mental Health, I'm sorry it's so small, but it's indicative of how many projects that were funded. There were 350 units in Brooklyn and 350 in the rest of the state. And it was rental assistance subsidies accompanied by support services. OPWDD, the Office for People with Developmental Disabilities, really has been focused on sort of transforming its entire system, which was based on institutional care or congregate care, and moving people out into supported living where that's appropriate. And all of these projects were funded. You can tell they're small projects in many cases, but it's to move people out gradually into the community. And this is sort of OPWDD beginning to get its feet wet, but really committed to shifting its whole service paradigm. And this money was very helpful to OPWDD in doing that. My agency, the Office of Temporary and Disability Assistance, this is our homeless housing and assistance program, which does capital construction. You can see this money was for, in the Finger Lakes, United Cerebral Palsy is in Ontario County. Through this, we'll serve homeless people with traumatic brain injury, physical disabilities, and developmental disabilities. In Mercy Haven, which is in Suffolk County, it's homeless persons with mental illness. Opportunities for Broome is in Binghamton. It's for chronically homeless people with a disability, mental illness, substance abuse, and or HIV/AIDS. The Polish Community Center of Buffalo is chronically homeless persons with mental illness, substance abuse, HIV/AIDS. And Providence Housing Development Corporation is in Rochester. And again, it's chronically homeless people with substance abuse issues and or ex-offenders. So you can tell in these upstate communities, as we all know, that if you can serve this sort of core of chronically homeless people in an intensive way, you can greatly reduce both your cost to the homeless shelter system, homeless service system, as well as to the health system. So a relatively small investment in these upstate communities can transform the housing and service system. This is also in our agency, which is the New York Supportive Housing Program. We provide funding for support services for supportive housing programs. As you know, it's sometimes easier to build a supportive housing project than to run it, and our money provides sort of operating funding for these programs, and this Medicaid funding is specifically targeted to the high-cost Medicaid users within these projects. So those are the programs that were funded last year. All told, it's a little less than 5,000 individuals were helped with this money, which we think is a great start to a program. And as I said, one of the side benefits of this was the increased collaboration. As we worked our way through the evolution of the Affordable Housing Group, I sort of had a feeling of deja vu. In my earlier life, I sort of lived through the creation of the continuum of care process, starting in 1994. And I watched sort of the same stages of development, which is people first coming to the table, determined, as well they should, to represent their constituency above all others, and sort of not being able to speak to the other people in the room. Like the acronyms from the Department of Health are not the same acronyms as we have in our agency. The acronyms in HCR, frankly, are not even the same acronyms as we have at OTDA. And even, for example, to give you a really silly example, supported housing, as you know, at OMH, is really different from supportive housing at OMH. But in the rest of the agencies, supportive housing is the name we give to unlicensed housing with support services. So we started out, as I said, with everybody really focused on their own constituency and really, frankly, coming from their own culture. And as the group progressed, you began to see people really beginning to understand the needs of the other people in the room. It was very interesting. One of the early splits was between homeless providers, that's what I spent my life doing, and people that were really interested in moving people out of nursing homes into lower levels of care. I quickly began to understand that we both had the same issue, which is wanting the appropriate level of housing for the people that we cared about and reducing costs whenever possible, using our resources really wisely. And there were people that came from senior housing who didn't understand the issues that people that had worked with, for example, people strictly in the mental health field. But as time went on, I think there was a tremendous learning experience. The silos began to sort of melt down. As Liz said, as committees formed, there was even a lot of work happened in the committees. And the committees eventually, this year, the first year, we were really in a rush. And so there wasn't quite as much bottom-up recommendations. This year, that really turned around. And the other thing that happened is that there began to be collaborations, more collaboration, even, say, on the state level. I have to tell you a terrible secret, which is that we people at the state have always talked to each other behind the scenes. We never funded, HHAP never funded mental health housing without asking OMH what they thought about the provider. But those were sort of hit and miss. Now we were sort of, thanks to Liz's leadership, we were now meeting weekly to talk about what was going on with our projects. And we began to see other ways we could collaborate. So, for example, in the HCR capital funding, they realized they could make use of rental subsidies that had been funded by OMH 2 years ago, but didn't have any capital project to put them in. So they realized they could pair those. We realized that we could, because we got MRT, HHAP money through the MRT, for upstate, we realized we could use some of our regular HHAP money for downstate and contribute to HCR's MRT-funded projects. And I think that kind of collaboration is only going to continue across the board. So while I think that my personal opinion is we've been good shepherds of the money and that we've already had a lot of success, I think there'll be even more success from this enhanced collaboration.